Hello, my name's Stephen and I'm a pharmacist that works here at Leeds Children's Hospital. I'm on an integrated clinical academic fellowship funded through the NIHR. I'm here to talk a bit today about the work I'm doing about helping families to use medicine safely at home. So my research activity and ideas really is born out of listening to families and parents in particular about how they use medicines at home, and particularly about how the problems that they face with using medicines at home, which is really something that is a very common feature. As we can appreciate, being experts on medicines, they're difficult to use correctly. They can sometimes have complicated instructions. As you can see by this picture, some patients are on lots of different types of medicines. But even something as simple as just giving a child 1 or 2 tablets a day can still present problems for families. So that really is where my ideas come from. So we know, and that's backed up in data in terms of there's a review out showing that about 9 out of 10 families will actually use a medicine incorrectly at some point. So there's a real need here at the moment to try and develop further support for families to help them use medicines correctly, because if medicines aren't used correctly, then we know that there's significant adverse or negative outcomes for families in terms of increased GP visits, increased hospital admissions, anxiety and stress for families. So this is an area that we really have an opportunity to improve things for families. So my fellowship so far, I've been doing a lot of work essentially following the Medicines Research Council framework for developing a complex intervention. We can't just jump into develop an intervention yet unless we actually have a thorough understanding about the factors that affect medicines use at home. So what I've been working on so far is just to actually try and capture that experience a bit more. So I've done some work with families to learn a bit more about and uncover the problem a little bit more and get a bit more background in terms of the issues that families are facing. As part of developing the research project, I've then looked at how we might go about developing theory. If we're going to interview people, how are we going to capture and ask the right questions that will then get us that understanding that we need about how medicines are used and what families need to improve the way they use medicines. And then finally, I've been doing engagement work, so running a focus group last year, talking to families about the research idea and getting their involvement in how I can improve the project. And these things are really things I'm looking forward, looking to progress forward into my doctoral research application. So the doctoral plan will build on those we'll build on that work really. So year 1 will be a literature review in order to understand what's out there already. The evidence is very patchy. The year 2 study that I'm planning to do will be a qualitative study looking at interviewing families that use medicines at home. And I know already from looking at the literature that will be the first study, certainly in the UK at least, that's actually looked at families using medicines at home. So we should get some really good understanding and good data from that project. I'd also look to interview healthcare professionals as well, so get the understanding from both sides about medicines use at home. And I will try and do a reflective element to that, so get practitioners and families to think about perhaps an example of when a medicine or when a problem has occurred at home and how they dealt with that problem and what was the outcome. So those 2 projects together will then lead into a co-design process at the end of the project. So this will perhaps be where we get the blank sheet of paper out, sit around the table and think about what actually interventions we might like to see going forward. And then we'll be able to choose with the theory that we've built up in the first and second years about, well, if that's something that we want, is it actually going to work? How is it going to work? And start thinking about like how we would measure that. And that should be about as far as I'll be able to get with a doctoral research fellowship. So we'll then look at progressing that work into a postdoctoral project, which would look at feasibility testing and randomized controlled trial, or a way of assessing the intervention about whether it's effective or not. So, and that could be lots of different things. So it could be consultation, it could be medication review, it could be education things for families, it could be information for families, or it could be some novel technology using perhaps something like smartphones to increase the support that we give to families for medicines. So there's really a lot of opportunities going forward in terms of what we might be able to do. So very exciting time at the moment, funding application going in. Hopefully we'll be finding out soon towards the end of the year, beginning of next year, about whether it's funded or not. To keep up to date, please follow me on Twitter. We've also got a Leeds Nerds group, which was the patient involvement group that I set up, that we post activity on there as well. If you want to just contact me on my direct email for any specific questions. And also, I did a longer webinar for the NHS SPS Medicines Use and Safety Network that was in December last year. So if you've got an nhs.net email, you can register on the website and listen to that, which I talked for about 40 minutes on the subject. So there's much more detail there. Thank you.